Welcome to the Potterblog site, September 30th, 2013. The Centers for Disease Control has released an award to the Poison Control Center and United Way 211 phone line to create a national nurse triage line during a severe influenza pandemic. The key word here is triage. Now, this is a sole source contract, and here's the justification for it. And we have links to this on our website. But this is probably why you're watching this video, because of this headline. It says, the reemergence of H7N9 virus and transmission among people in the United States remains a possibility. And if that occurs in the fall of 2013, the United States healthcare system is likely to be overwhelmed. And then down here, it is important to begin this work as rapidly as possible to prepare for possible transmission of the H7N9 influenza virus in the United States. Now, this is just one of many things that they're doing. In fact, if you look at the whole context of what's out on the federal biz ops in support of this, basically they've implemented the entire C4 ISR concept in support of this. And that stands for Command, Control, Communications, Computer, Intelligence, Surveillance, and Reconnaissance. Now, if we think for a second about the key word here, and that is National Nurse Triage Line. So what does that mean, triage? Well, triage basically means to decide who gets treated with what, when, where, and why. Now, why this is the most overwhelming thing in the fall of 2013, two reasons for this. One is there's no vaccine currently available. Probably in spring 2014, they'll have a adjuvant-laced experimental vaccine available. But right now, there's no vaccine available to stop this. So, what do? Well, if there's an outbreak, and likely it'll come from the Pacific, the first thing they're going to do is just throw antivirals at it. And they're taking massive antiviral dosing steps to halt and triage such an outbreak. And that's what one part of this 211 line is. Now, the bad thing about that is this type of rampant antiviral dosing would likely put a strong natural selection pressure on the existing virus to mutate into an untreatable variant during the next flu season cycle. Now, that cycle could potentially be fast enough that they can't get an updated vaccine out in time. So that would be ineffectual against the mutated version, or just as likely that antiviral gambit may not halt the outbreak or progression of H7N9 to other cities. So that begs the question, how would the CDC triage a medical system overloading infection, which is only symptomatically treatable, has a 66% death rate with hospitalization, and a nearly 100% death rate if advanced life support equipment is not available? So, there's two aspects of this triage. One is the initial gambit to try to stop it in place and halt it. And as part of that, there is an entire slew of federal biz op solicitations and awards out there in support of this. FCC and CDC are working together on the emergency broadcast system, or emergency alert system, to basically broadcast an emergency alert to the entire country in high def to explain what to do. The other things they're doing is they have a surge tempo delivery order out for strategic national stockpile push packages. These are all medical supplies and federal medical stations to be delivered all within 12 hours anywhere along the Pacific Rim. They're also setting up 1,000 hoteling stations for 100 medical personnel each across the United States. Now, sounds crazy, doesn't it? Well, If you look at what the contractor says, one of the contractors who's bidding on the mobile restrooms and showers, he says, "I think this Armageddon scenario is too large. We could address and service the 20 camps in California, the 5 in Oregon, and the 5 in Washington." Now, also as part of this, there's an order out for 100,000 doctor's scrubs, Dickie brand, and 100,000 basically medical sweatshirts and sweatpants, winter sweatshirts and sweatpants to go along with it. Incredible amount of short-term planning. Now, again, if you think this sounds logistically impossible on such short notice, you may just be too smart to work at FEMA. Shades of Katrina. But so let's say all this effort doesn't stop the this outbreak, potential outbreak, from spreading. So these efforts are to prevent it from spreading and to prevent it from overwhelming the system. But what is the triage when the system has been overwhelmed? And what exactly overwhelms the system? Well, it's a very interesting story out today of a person who's just been released in China for medical treatment. I think he's the last guy out in Jiangsu. He spent 170 days in the hospital. I think 85 of it attached to a respirator. He's still got an additional 6 months of home treatment required. Spent multiple days in a coma. So there's a study out here, and let me show you this real quick. Comparative epidemiology of human infections with avian influenza A, H7N9, and H5N1 viruses in China. A population-based study of laboratory confirmed cases. So what they're doing here is comparing a known avian influenza virus, H5N1, that's been around for several years, but it's only caused like 40 hospitalizations or such, and H7N9, which just popped on the scene and has already caused over 100, nearly 200 hospitalizations that we know of. So that's what makes this so explosively dangerous. Now, if we look through here, we'll see a set of charts. And let me scroll down to them. And these are the charts that give away the difference between H7N9 and H5N1 and what makes it so potentially dangerous. And what we see here, and I'll zoom in on this in a minute, there's two graphs in each one. Blue line is H7N9, red line is H5N1. Over here we have days from infection to illness onset, days from illness onset to hospitalization admission, that's a key one, days from hospital admission to death, and then down here on the bottom, days of hospital admission to discharge. Now these are probability density functions, and so this value up here on the y-scale is a probability density. And it's a little complicated, but basically what it means is that this entire area under the curve equals up to 1, 1 being 100% probability. So at any particular spot, if you want to know what the probability of someone being in the hospital for 7 days, you come across here and it looks like it's 0.045, which would be 5%, 0.5%. But so that's how you read these charts. Now, when I look through this chart in detail, they don't actually give numbers; they show charts. I saw some things in this chart, in this research report, that made me think that they were at some points confusing mean with median values. We'll get into more detail on that in a minute, but let me zoom in on this real quick here so we can make these charts just a little bit bigger. Let's type in a zoom. 300%. Alright. Here's a very important one. Blue is H7N9, red is the older H5N1. This is how quickly time between illness onset to hospitalization. The red line they modeled as a Weibull, and then the blue line they modeled as a gamma distribution. Now if you notice here, from the instant people got sick to the people got into the hospital is left shifted. So it looks like these people got into the hospital 1 or 2 days earlier than they would have with H5N1. Probably the reason for this is the basically information that the pandemic existed, so people were on the lookout. So if they started to feel sick, they didn't hesitate a day to feel better. They went to the hospital immediately, and they were sick enough to get admitted to the hospital. So this left shift is crucial. People were getting into the hospitals faster, admitted into the hospitals faster than with H5N1. Now, here's another chart. Days from hospital admission to death. So these are the people that died. Now, if you look here again, with H5N1 in the red, majority of people died very quickly. It looks like the median on this is about 4 days, and the mean is about 7 days. So on average, people were dead within 7 days. Now, in these charts, the difference between mean and median is the median is the middle dividing point of area. So that's when the point where on the left side of the chart you have the same amount of area as you do on the right side of the chart, and that's the median, or the middle of the chart. The mean, which means average, that's the center of gravity of this chart, and that is, if this were a wood block cut out in this shape, where on this block you would put your finger to balance it. What's the balance point? And the difference between that is that points that are way out here on the side, they have more leverage against the center point. So that's why the center of gravity, or the mean, is not located in the median, or the middle of the chart. Just a slight explanation there, what's going on. But again, the H7N9 deaths are dragged out much further, whereas the H5N1 deaths were much more immediate in the hospital. So you've got people sicker in the hospital longer before they die, and these people require respirators. And here's the other interesting chart. Huge difference here. This is days from hospital admission to discharge. So again, if you look at this chart, which is H5N1, you can see it looks like the median here is about maybe 10 or 11 days, and the mean is probably 16 or 17 days. And you compare this to the H7N9 chart, and you can see that the median is about 45 days, and the mean is probably about 50 days. And the most recent case we just told you about, he was in the hospital for 170 days. So that's 170 days tying up a respirator in an ICU bed where other people can't be treated. So why this big difference? Are these any more virulent? There is probably some virulence difference, just because the human body's not used to H7 type viruses. I'm going to show you to what is a strong explanation for this difference, and that is the earlier arrival of sick people in the hospital. So early intervention into the hospital, it would appear, gives a much better chance of tying up a hospital bed for much longer, but still dying at the end. And even if they improve, they're in the hospital bed for 40 days. That's why this H7N9 could potentially just overwhelm hospitals. Now, the primary constraint in any hospital is the number of respirators, and that's because respirators are very expensive. So there's not a whole lot of excess respirator space available on them. And the people who are on respirators normally are on them for a long time, because they're in hospice care or nursing homes or things like that. So they don't free up very easy. But it's very interesting. Anybody who's looking at population-based triage amortization of this would look at this and say, early arrival into the hospital potentially equates to much longer hospital stays, still equaling death, and even hospital stays where even if they don't die and they get discharged, they're in for the hospital for 30 to 40 days longer than if they'd waited just 2 days earlier, or waited a few days to get to the hospital, which case these people would probably also die. So there's a very strong economic push, if you look at this chart and you think about this data, to delay people from getting into the hospital for 1 or 2 days. And that way the people who are really sick and have a really high chance of dying are going to die off and not tie up your hospital beds. Whereas the people who have a chance of living are still going to tie up your hospital beds, but there's not going to be as many of them. And these are probably your VIPs you're going to get selected for ventilators in a overwhelming situation like this. So it's a very troubling sense of triage. Now, how do you delay somebody from going into the hospital for 2 days? Well, this very same nurse triage line here being set up by poison control at the initial part of the outbreak is great for, if I had to tell people to call immediately and then immediately dosing with antivirals and hope they work. But if they don't work and it spreads, it's just as easy to continue to give these people antivirals that don't work and say, wait until you get really, really sick before you get to the hospital. Now, really what all that is it's a form of a death panel. So what is a death panel, you might ask? Well, we've come up with our own definition here, and let's see if we can find it here. Basically, what it says is triage designed to delay and mete it out based on herd population statistics instead of being based solely on individual health amounts to nothing more than a death panel. Now here's a key thing that one massive employer in the United States, big dollar company, what they've done is they've hired a private contractor to perform house calls on their employees, telemedicine and house calls. Now this same major corporation in 2009 engaged in significant pandemic preparations. So they've contracted out to Carina. Now, Carina is a telemedicine and home house call company. Now, Missouri, I don't believe they're allowed to do telemedicine in Missouri. So Missouri, they'll only do house calls. So, people who can afford to get to private telemedicine may have a much better chance of surviving in an overwhelming scenario, overwhelming hospitalization scenario than people who dial into a 211 line. So another concern about these potential 211 lines is the quarantine aspect. Once you get on these, once you call in, it's very possible that you might be isolated and quarantined. So if freedom of movement is a concern for you, then brings us to our next phase here, which is, there are things that can be helpful. If you remember, just a few minutes ago, we discussed that FEMA has ordered 100,000 Dickies to be delivered, Dr. Scrubs, to be delivered on 24 hours notice. Typically, in these disaster medical teams, they prefer tan scrubs. So my guess is people wearing tan hospital scrubs are going to have be much less likely to be challenged when engaging in movement. Another aspect of this is it's not necessarily super expensive if you go to a doctor and have him pre-stockpile you with antivirals. Don't know if they're going to work or not work, but that's one less phone call you have to make. Now I'm going to show you the one piece of equipment here that, if this sort of thing happens, will become unavailable at any price. And that's a Philips Respironics Bi-PAP machine. This is basically a cheap $1,000 at-home respirator used by people who have neurological sleep apnea. So as people who stop breathing when they sleep, this device helps keep them breathing by forcing air in and letting it escape, and then forcing it back in. A little bit different than a CPAP, that it's not continuous. But I would expect every one of these Bi-PAP machines to go completely out of stock immediately once there's any sort of outbreak of any major note anywhere in the world. These things will become immediately unavailable. I think typically these things cost around $1,000. Need a doctor's prescription for one, but you know, this is likely the one item that's going to be extremely valuable, and that might keep somebody's life going when they couldn't get into a hospital. So a lot of troubling things here, but let's end on one good note, and that is that there is some contingency or some hope that alpha interferon is a treatment for H7N9. And there's a link here to a video from a doctor coming out of Vanderbilt where they've done some tests which showed it was very effective against H7N9 in animals. Now the good thing about alpha interferon is I think it's like $40 a shot, but it's already in use in people to treat things like hepatitis and other things like that. It has some disqualifications for people who have lupus. So there is a potential positive side to this, and they claim that they might be able to ramp up, but upscaling batch microbiological production to industrial superscale production ain't always easy. So a lot of things to be concerned about here, but don't have to take our word for it. Listen to the CDC, that the U.S. healthcare system is likely to be overwhelmed. And if you look through all this crazy planning through here, and we have links to all of it, or to the vast majority of it, something to be very aware of what's possible. Good night.